Good morning, all of you. I think that still some are joining that we can do the proceedings, the basic proceedings. So I would like to invite Director Madam of the Institute of Indigenous Medicine, Senior Professor Piani Parnagama, welcome our resource person today, the Professor Neelika Malavige. Over to you, Madam.
Thank you very much, Dr. Kamal. I really appreciate in organizing this event. So Professor Neelika Malavige and all the academic staff members, this is a very important topic and timely topic that has been organized by Dr. Kamal Perera as the webinar on current status on COVID-19, myths and fact on the vaccination process. We, as the Institute of Indigenous Medicine, I am very sure this is very important to our academic staff members as well as the students. And we know that Professor Neelika has done a lot of research on this topic, and also, she has about these vaccination processes, and also about the virus, different varieties, so on. I'm very sure this will be a very knowledge eye-opener for everybody in indigenous medicine. We have experts in Ayurveda and Unani medical systems, and also the students also maybe wanted to know and upgrade their knowledge related to this COVID-19 vaccination. And I welcome you, Professor Neelika Malavige. She's the head and the professor of the Department of Immunology and Molecular Medicine, Faculty of Medicine, University of Jayawardenepura. And also I really appreciate for accepting our invitation. I know that you are a very busy person. With the busy schedule, you have accepted our invitation and kindly agreed to deliver this seminar. And I'm very sure everybody will, update their knowledge, and also help all of us to why we had to take the vaccination, and is there a myth and fact on this vaccination process. I'm very sure she will help us to understand the reason why we have to take vaccination process. Even we know that the government has has put a regulation and issue a gazette notification. If we don't do the vaccination, we will not be able to go for common places, gatherings, so on. So why? And I'm very sure she will help us to update our knowledge. And also I welcome all our staff members and also all the students who joined today. And this will be a very helpful seminar, and I wish the seminar success. Thank you.
Thank you very much, Madam. So before going for a proper, I would like to give a brief introduction. Actually, I don't need to give an introduction about Professor Neelika Malavige. All know about her, but as an agenda, I would like to give a brief introduction about her career. The Neelika Malavige is a professor and head of the Department of Immunology and Molecular Medicine, University of Jayawardenepura, Sri Lanka, and also an academic visitor at the University of Oxford since 2008, after completing her PhD studies at the MRC with the All Institute of Molecular Medicine, University of Oxford. She is a member of Executive Committee of the International Society of Infectious Disease since 2020, and a member of Technical Advisory Group to the WHO COVID-19 Technology Access Pool. She is a fellow of the Royal College of Physicians in London, the Royal College of Pathologists in 2015. She serves as an expert member on several government COVID-19 related technical advisory groups. She leads a large research group working on dengue and COVID-19. Her work on dengue has focused on factors that have led to severe dengue identification of biomarkers and mediators of vascular leak in dengue. Her work on COVID-19 is mainly related to immune response to COVID-19 vaccine, immunopathogenesis, and determining correlates of protection against COVID-19. She has strong research collaborations with the University of Oxford, and her laboratory is a part of the A2 CARES, which is one of the Center for Research and Emerging Infectious. Maybe in future emerging infectious also handling with this center. She has won many awards and received many local and international grants. So it's a marvelous career, so over to you, Madam.
Thank you so much for this invitation, and it's my pleasure to talk to all of you this morning. Let me start by sharing my screen. Hope everybody can see my screen.
Yes, it's visible.
Okay. Okay, thank you. So what I'll be talking about is the current situation of COVID in Sri Lanka, which I believe all of you are aware of. And of course, an important question of whether we actually, it's true that the government has put out a circular gazette notification, but is it necessary? Should we boost or shouldn't we boost? Okay, and of course, the mix. So to start off with, I know everybody knows that this is what happened in Sri Lanka. So I have already put the case number since September 2020, because before that actually we didn't have many cases at all. And this is the so-called second wave, which is actually the first wave, then the alpha wave, delta wave, and we can see cases rising due to Omicron. But of course, we know that this is not the true story because testing is very limited. Although it's limited, I believe there is no need to test each and every cough and cold. So I think the testing strategy has changed according to the country needs. Because if you see, the positivity rate has definitely increased. So if we adopted the same testing strategy we adopted in the sort of the first and second wave, like even testing asymptomatic people and contacts, our daily case load will easily be something like 20,000 and not 2,000. And of course, this is because this massive spread all over the world is because of this Omicron. We had Alpha, Delta, and of course now it's Omicron. And so in US and UK and many countries, Omicron is the only variant. I'm sorry about our dog. Whereas in Sri Lanka, Omicron accounts for about 97% of infections as of our last sequencing round. So about 3% of infections is not Omicron. Now, what did Omicron do to Europe, USA, and Australia? So let's talk about other countries as well. So this is the first wave, second wave, and so on. I mean, we know that in the West, US, Australia, and so many countries, there was massive devastation with previous COVID variants. So these are the previous, the number of cases in the previous waves, and this is the Omicron wave. Okay, so we can see the number of cases because of Omicron. I mean, you can't even compare the infection rates of Alpha, Delta, Beta, Gamma, you name it, when it comes to Omicron. Omicron is causing such a large number, such a huge rise in the number of cases. Okay, but fortunately, when you look at the number of deaths, this is the same countries, you can see the number of deaths is very much less when you compare to the previous waves, which is fortunate. So you have very high number of cases, but reduction in deaths. However, this is this morning's report from Worldometer, which you can access. Yesterday, new deaths, USA is still having 2,777 deaths. I mean, that is enormous, right? I mean, what are the vaccination rates in US? And India, on the other hand, has far less deaths. I mean, we have to go by the population, okay, the population statistics. So we know the Indian population is very different to US. And Brazil, of course, so many people have been dying from the beginning of the pandemic. And UK also, despite such a lot of vaccination, I mean, okay, not like USA, but still people are dying. So aren't these vaccines absolutely useless? Okay, I mean, if after vaccination and in the second year of the pandemic, if so many people are dying in USA, it's, I mean, it just shows that these vaccines are useless. Okay. And also, if you look at the number of cases, I mean, this is Denmark, Netherlands, France, European Union, where the vaccination rates are so high. But despite all this, the number of cases are like this. So, I mean, somebody asking, are these vaccines useless? What's the point of vaccination? I mean, that is a very important question. So now let's ask the question, are these vaccines useless or not? After all, I mean, just look at this. When you look at this slide, it's very evident that the vaccines are useless. So now, before we come to this question, let's talk about Omicron. Okay, fortunately, Omicron causes a milder infection than Delta, and the main symptoms are runny nose, headache, fatigue, sneezing, which of course all of us get several times a year because of common cold. Loss of smell and those things are less. But unfortunately, although Omicron is milder than Delta, it is not milder than the original SARS-CoV-2 Wuhan variant. It is not like a common cold, necessarily like a common cold in unvaccinated people. It does cause hospitalizations, ICU, and death in high-risk individuals. Okay, so do vaccines do anything at all? Now, coming to the question. Now, after all those vaccinations and boosters, so many people are dying in America and Europe. So, a useless vaccine, or is it? Let's focus on Switzerland. Okay, so these are the deaths per 100,000 population. Okay, so if you look at Switzerland, this is 60 to 69 age group, 70 to 79, and 80 age group. So these are the deaths per 100,000 per unvaccinated. So these gray bars are unvaccinated. The red ones are individuals with 2 vaccines. So of course, over and over again, it has been shown that the number of deaths or the proportion of people dying who have had 2 vaccines is very much less. Okay, and this is United States, again over 60, 65, 50, 64, and 18. So of course, 2 vaccines significantly reduce the chance of somebody dying. What do boosters do? This is what boosters do. Okay, when you take a booster, because even after 2 vaccines, you can see some people do die. Okay, it's not 0. But after boosters, can you see it significantly reduces the proportion of people dying? And I believe a lot of you who are listening in could be between the age group of 18 to 49. And after boosters, basically nobody dies. Okay? So after boosters. Now, what is happening to America? I will explain in a minute. And when you look at the United States, the overall deaths prevented by boosters. So this is again the rate per 100,000 people. Okay, and you can see when it comes to 100,000 people, the unvaccinated people, when they receive 2 doses, there's a 14 times less risk of dying. But with the booster, there's a 97 times less risk of dying. So this is for all age groups put together. So boosters do significantly reduce the proportion of people dying. And actually, if you go back to 2019 December, and just imagine a news report came out saying there's a new mysterious virus causing a sneezing and runny nose and a flu-like illness in China, nobody would pay attention at all. The only reason we were paying attention to this COVID is because it killed, because it put people in the ICU, because it caused severe pneumonia. If it was causing a common cold-like symptoms, nobody would care about COVID at all. So the booster doses, vaccines, trust the booster dose, achieve this, which is, this is enough evidence, I believe, that vaccines are working, they are doing what they are doing, which is preventing death, ICU admission, and so on. And there was a webinar for doctors on Sunday, and I can tell you the IDH data presented by Dr. Vijay. Currently, there is nobody in the ICU or oxygen dependent who have got the booster. And Dr. Harsha Safishandra again presented data from NHSL, except for one person who has a lot of comorbidities. Again, at NHSL, there is nobody in the ICU who has taken the booster. And this is data from the Colombo district. Within 10 days, from 21st January to 31st January, there were 28 deaths in the over 60 age group, and no deaths in people who have taken boosters. So boosters very much keep you alive and keep you out of the ICU. But of course, I believe a lot of people who are listening are young people. And of course, you can think, I mean, come on, okay, what is your risk of dying or going to the ICU? You are young, you are hopefully vaccinated. Why on earth should you get a booster? Because you're not going to die. And the important thing for you would be to prevent you getting into hospital. Because, I mean, there are children to care about, work to be done. You do not want to go to the hospital. So what does boosters do to hospitalization? So this is again US data showing. So this is the start of the Omicron predominance. And you can see the hospitalization rates in unvaccinated people are shooting up. The vaccinated people hospitalization rates are not increasing that much, but they are increasing. But these are the boosted people. Okay, so booster doses effectively keep people out of hospital, because I don't think anybody actually wants to get into hospital either. Now, coming back to America, why are so many people dying? I know by now everybody knows that it is the older and the vulnerable people who are dying. So this is Portugal. Okay, so I mean, although there's Omicron going on in Portugal and a large number of cases, these are hospitalization rates. I mean, basically people in Portugal are not going into hospital. This is because 90% are fully vaccinated and 35% boosted. On the other hand, in United States, because of the very strong anti-vax campaign, 12% of the over 65 population are not vaccinated, and only 23% of the total population is boosted. So a large majority, 12% is a significant population of people over 65 are not vaccinated. And if you look at the whole US population, 69 million of eligible adults have not taken a single dose. So when you have 69 million individuals who have not taken a single dose, of course, when you have Omicron going around, it will kill people. And it kills over 2,000 people every day in US, unvaccinated. Now, of course, now isn't natural infection good? I mean, if you get natural infection, doesn't it protect against Omicron? Now, the problem is, earlier we had Alpha and Delta. So if you got Alpha and Delta, it does protect against reinfection against these viruses, because although these were variants, they were very similar to each other. But Omicron has mutated so much, it is so different to the previous variants. So you can see in New York, the rates of hospitalization, okay, the rates of reinfection. And this is UK data, the number of infections since the beginning, and you can see the number of reinfections. So protection against reinfection following natural infection with Omicron has fallen to 19%. So natural infection doesn't actually protect you against reinfection. And unfortunately, naturally infected people, naturally reinfected people are dying as well. Okay, so this is, these are deaths in reinfected people. And you can see when you're reinfected, like, okay, you get Alpha, Delta, or the Wuhan variant, and where you are reinfected with Omicron, still you can die. Okay, so natural immunity does not prevent against infection or death. Now, of course, the question comes, is the Pfizer vaccine safe? Okay, I mean, it is an mRNA vaccine. This is, you know, like a strange thing. It was developed overnight, or was it developed overnight? That is the other question. Is it safe? Now, last Friday, the world celebrated giving 10 billion vaccine doses, COVID vaccine doses all over the world. Okay, 10 billion. So 10 billion vaccine doses have been given. And of these 10 billion vaccine doses, over 1 billion, that is over 1,000 million, are Pfizer vaccine doses. Okay, so such a large number of individuals in the world have received the Pfizer vaccine, and about 1 billion have also received the Moderna vaccine, which is again a mRNA vaccine, a similar vaccine. Okay, so close to 2 billion mRNA vaccines have been given out in the world, and you know that these people are alive and not dead. And when you come to Sri Lanka, as of yesterday, 5.8, not yesterday, okay, 6th of February, 5.8 million booster doses have been given in Sri Lanka. So 5.8 million individuals in Sri Lanka have received Pfizer as a booster dose. That is again a large number of Sri Lankan individuals. All of them are fine, which I'll tell you in a minute. And of course, for children, The only vaccine that is given is Pfizer, because other vaccines, there is no trial evidence for other vaccines. And in Sri Lanka, over 1 million children have received the Pfizer vaccine. So one of the problems that people were worried about the Pfizer vaccine was the incidence of myocarditis that may occur in children. So it has shown in other countries that when you give out 1 million doses, you may get myocarditis in about 5 to 7 individuals. So now we have given over 1 million doses of Pfizer in children in Sri Lanka. So far, not a single dose of myocarditis has been reported in children. I don't know why. Maybe it's a genetic predisposition, and Sri Lankan children don't get. In India and other Asian countries also, this myocarditis business was in South Asia was not that prominent. So it could be genetics, but so far in Sri Lankan children who have been vaccinated, over 1 million children, myocarditis has not been reported. Now I'm just showing you booster guidelines in different countries, and in UK, boosters are given to everybody over 16, 3 months after the second dose. USA, everybody more than 12 years. So because children are also vaccinated, it's 5 months after the second dose. Australia, same as UK. In Singapore, it is over 12 years, like USA, sorry. But in Singapore, which is one country which uses Sinopharm, they give 3 doses of Sinopharm or Sinovac, okay, which are inactivated vaccines. So for older people, more than 60, they give 3 doses of Sinopharm and then a booster. The reason is based on the WHO guidelines after reviewing data, because Sinopharm is an inactivated vaccine, the immunogenicity after 2 doses is not that great. So this is why the WHO has advised to give 3 doses of Sinopharm or Sinovac, especially to over 60 years. And in Singapore, they give an additional dose. And Malaysia is the same as UK. And in Dubai, of course, again, another country that used a lot of Sinopharm and Sinovac. So in Dubai, they used 2 doses of Sinopharm or Sinovac. So after 2 doses of Sinopharm, they recommend 2 doses of Pfizer. So they don't receive just 1 Pfizer booster, but 2 Pfizer boosters in Dubai, 3 months after the second dose. And Dubai right now, nearly all of the population has received 2 doses of Pfizer as well, and everybody is alive and happy. Now, these are the Singapore guidelines. Somebody is not muted. It would be good if that person, there's background noise, could be muted. Okay, so in Singapore,
please mute the mic.
In Singapore, another country which used, as I just mentioned, used Sinopharm and Sinovac. They give 3 doses, and after 3 doses, they give the booster. And so there's a difference between the booster dose and additional dose. Additional dose is in the primary vaccine series, the number of doses people get. So in immunocompetent individuals and individuals less than 60 years of age, 2 doses of Sinopharm were given. But in immunosuppressed individuals and in older people, additional dose was recommended. And on top of that, a booster dose is recommended. So you can refer to the WHO guidelines updated on the 22nd of December. Now, of course, coming to the questions that people raise. Okay? Do boosters cause heart attacks? Once people are saying, so-and-so got a Pfizer, then 2 weeks later got a heart attack, got a stroke, 1 week later got a stroke, 3 weeks later got a stroke, got a heart attack. Okay, so the question is, do Pfizer cause heart attacks? Now, all of you know, because I'm talking to doctors, heart attacks are the main cause of death in Sri Lanka. Now, let's look at the data of the annual health bulletin in 2019. Okay, this is before COVID. In 2019, the total deaths due to heart attacks was 145,475. When you divide that by 365, that means 398 people died every day of heart attacks. And that is 2,792 people per week. And we know that most people that get heart attacks don't die. Most people are alive. So actually the proportion of people who develop heart attacks per day is at least 3 times more. What about stroke? Again, the total deaths due to stroke is 60,757. And again, we know that the most people who get strokes don't die. Okay, so these are the extreme. So the number of people who die of heart attack or stroke is around 600 every day in Sri Lanka. Okay, and when 600 people die of either heart attack or stroke, that means at least 2,000 people get it, because most people who get a heart attack or stroke don't die. Okay? And just because you get a Pfizer, this is not going to change. Okay, just because you get a Pfizer, still about 2,000 people per day in Sri Lanka will have a heart attack or stroke. Okay, so because of heart attacks and strokes are so common in Sri Lanka and in other countries as well, a lot of people who die of heart attacks or strokes, naturally, it will be attributed to the Pfizer. So it is just because they were anyway going to, because, you know, like if 600 people die every day and 2,000 people get this, that's a lot of people every day. But this paper is out, this is in Nature Medicine, looking at COVID and heart disease. So a lot of people did get heart disease, and even young people, they succumb to their illness because of COVID, getting heart attacks and so on several months after getting COVID. So COVID, in the absence of vaccination, because one important thing of the vaccines, it prevents the virus going around in your body and causing all these side effects associated with COVID, like your coagulation profile changing. We know that COVID causes coagulation and thrombosis, and of course, COVID was associated with thrombotic disorders, inflammation of the heart, heart failure, cardiomyopathy, ischemic heart disease, and cardiac rhythm disturbances. Okay, so this is what COVID did. And so the thromboembolism in COVID was so much higher and was an important cause of mortality. This thromboembolism was shown to occur in about 21% of ICU patients. And that was an important cause of death. And we know that in Sri Lanka, when somebody goes to hospital and when they have, not just in Sri Lanka, everywhere as well, they are given anticoagulants to prevent blood clotting, because COVID is associated with blood clotting. So you need to stop blood clotting. So anybody who goes into hospital and has risk factors right now is given anticoagulants, and because it's an important cause of death. But not only in people going to hospital, this is a case study in fatal pulmonary embolism in asymptomatic COVID-19 people. Okay, so this is before vaccination, and where people were tested a lot. So then a lot of asymptomatic people were picked up, and unfortunately, even asymptomatic COVID causes coagulation, increased coagulation, blood clotting, and of course, there have been deaths of people who had asymptomatic COVID because of pulmonary embolism. And vaccines prevent this because they prevent the virus disseminating and causing a systemic illness. And the important question, does Pfizer cause importance of fertility issues? Okay, so, and again, you can refer to this paper, which shows that it is COVID that is a risk factor for new onset erectile dysfunction. Okay, and if you don't want to read papers, you can read these websites, which is National Geographic or Forbes magazine. So erectile dysfunction is almost 6 times more after COVID. So COVID is a cause of erectile dysfunction and not the vaccine. And I just told you, nearly 2 billion people in the world have got mRNA vaccines, and they have not any issues with their sexual performance. But another issue is COVID also causes a temporary drop in the sperm counts in men. So the sperm counts may be low for around 6 months after COVID, so that the couples may have issues with getting pregnant soon after COVID because of the reduction in sperm counts, but this is temporary. The sperm count picks up after 6 months. So vaccines do not have this effect. And pregnancy. We know, unfortunately, in Sri Lanka, over 60 pregnant women died of COVID last year because pregnancy is altered physiology. And when pregnant women get COVID, they unfortunately have a lot of complications. And COVID in later pregnancy is associated with preterm birth, preeclampsia, stillbirths, and neonatal death. And we saw that apart from the 60 plus women who died because of COVID, there were a lot of stillbirths and preterm births in COVID, in mothers who got COVID during pregnancy. On the other hand, in COVID, vaccination in pregnancy has no increased risk of miscarriage, preterm birth, stillbirth, small babies, or congenital anomalies. And Pfizer is the vaccine of choice to be given in pregnancy because of the high safety profile. It only contains RNA, and because it only contains RNA, it is the safest vaccine to be used in pregnancy and being given everywhere all over the world in pregnant women. And of course, then about boosters. People are so worried about boosters because, I mean, we took 2 doses. Why do we need another dose? Now, let's look at all the other childhood vaccines that all of you, I know, have faithfully taken and given to your children. All the DPT. I mean, by 18 months, you have taken 4 DPT vaccines, 2, 4, 6, and 18 months. Then again, you possibly can't remember taking it, but your child is given another one around 5 years and another one around 12 years. And in pregnancy, pregnant women receive 2 tetanus doses. And even when you're 50 years old, if you have some injury due to a rusty nail, you get another tetanus booster. So when you're like 60 years old, you've had like 10 tetanus boosters if you're a female, especially who've had several children. And this is because, again, tetanus is an inactivated vaccine. If it is a live attenuated vaccine like the MMR, then you can do with 2 doses. But we know that COVID vaccines are not, none of the COVID vaccines are live attenuated vaccines. And for all the other vaccines that people get, okay, this is a Sri Lankan immunization schedule, they have to have several doses. No vaccine, except for the MMR, which is a live attenuated vaccine, do you get just 2 doses. So earlier, I know people thought that maybe 2 doses was enough, but that is a premature conclusion. And we know that you do need 3 doses to protect you against hospitalization, severe disease, and death. I also want to talk just briefly about the anti-vax movement. Because before COVID, we did not have anti-vax movement in Sri Lanka. Sri Lanka has one of the highest childhood vaccination rates, almost 100%. The very few children who don't receive the childhood vaccines are for medical reasons. Otherwise, every child in Sri Lanka is given all the vaccines. Okay, but there is an anti-vax movement, and which is a Western thing and not a Eastern thing or Asian thing at all. So I'm just showing you, if you look at the MMR, this is the MMR coverage in different countries. So in US, it's like 92%. In UK, again, 90%. In some countries like France, only 90% of children get the MMR. And if you look at US, in different states, in some states, the uptake is less than 90%. So these are the states which elected Trump, okay? So the Trump states have less vaccination rates than the Democratic states. So this anti-vax program was going on for a long time. And because of that, children in US, there was measles outbreaks in US, of course, because MMR protects against measles, and children in US died of measles, okay, which sounds impossible. No child in Sri Lanka died of measles during the past, I don't know, 20, 30 years. Okay, but not in US. In US, children did die in 2018, 2019 because of measles, because of this anti-vax movement causing such a reduction in immunization rates. And of course, the immunization campaign has been very strong in the West and has been also driven by celebrities. Okay, this is a Hollywood actress, and she is one of the celebrities which drives the anti-vax program to sell her alternative health products. Okay, and if we look at the famous tennis player who was deported from Australia because he did not take the vaccine, he too has invested heavily, bought a lot of shares in an alternative health company. And if you look at Sri Lanka, again, the main people who come on television and have these campaigns to vaccine recovery clinics and which sell very expensive medicine, again, is doing that because of vested interest. Okay, so the anti-vax campaign, which was a strong thing in the West, has come to Sri Lanka because of COVID, and this is because of current social media. And a lot of people in Sri Lanka unfortunately, even doctors take information from social media without actually finding out whether it is true or not, without reading the actual evidence. Now, just to summarize, I think I have shown that boosters are safe and effective, and about the anti-vax movement, and we have to accept that COVID is not going anywhere. This is it. Omicron, the immunity to coronaviruses is not long lasting. Omicron will remain and keep on reinfecting people, by the way. So you will get reinfected by Omicron as well. Unless Omicron is displaced by something even more transmissible. So if we are to sort of live and stop people dying and keep people out of hospital and get on with our lives, we have to be safe. And I think we are in a very bad situation with the economy as well. We can't go to lockdowns and cause such a lot of hardship to people. So by ending that, I would like to stop and happy to take questions, but it's just that I have to leave at 9 o'clock. Thank you so much for inviting me.
Thank you very much for your very informative and actually very clearly we got some sort of explanations. Do you have any question that actually I thought that there are so many things are solved. Do you have any other questions you can ask? There are some questions I got from students. One student said that the natural immunity I get from being sick with COVID-19 is better than the immunity I get from COVID vaccination.
Unfortunately not. Okay, because in US, because US and certain Western countries, even UK, there are enough and more people who have not taken the vaccine. In Sri Lanka, the majority, or only a very minority of people over 30 years haven't taken the vaccine. Okay, so we can't do these studies in Sri Lanka. It's difficult to find people who have not taken the vaccine actually. So in US and in these Western countries, they have compared natural immunity, people get repeated infection versus vaccination-induced immunity in keeping people out of hospital and preventing deaths. And they have found that actually vaccine-induced immunity is better.
Another question, that COVID-19 vaccines cause variants. Is it,
absolutely not true, because the variants occur is when the virus multiplies. So the more you let the virus multiply, the more it mutates, because every time the virus replicates, because these are RNA viruses, error rate occurs. And RNA, we know that RNA doesn't have proofreading, whereas DNA proofreads. So the error rate in DNA replication is less. The error rate in RNA replication is very much more. So when RNA replicates, error rate happens, and these are called mutations. And then the mutations accumulate and you get variants. When you have the vaccines, the replication is very much less. True that even people with boosters get infected. I mean, I'm sure you know enough and more people who have got boosters and got infected, got fever and all these things, but their viral loads are lower and the duration of virus replication in their body is lower. So, so this is why it is important to take vaccines, and vaccines reduce the emergence of variants.
From the chat box, what happens when vaccinated individuals
Get breakthrough infection?
Yes.
Yes. So when vaccinated individuals get breakthrough infection, because the reason that we do get breakthrough infection is this. Now, you have with vaccines, you have a lot of antibodies and T cells in your system, but these vaccines don't provide a lot of mucosal immunity. Okay, because if you had a live attenuated vaccine, that will do that, or a nasal vaccine. So your mucosal immunity is not that great. So you get infected and your upper respiratory tract epithelium gets infected. But because you have good protection in your body, the virus doesn't disseminate and cause all these coagulation issues, systemic issues that we see with natural COVID. So with breakthrough infection, you get a mainly upper respiratory tract infection and a flu-like illness that people are getting after boosters, but the viral loads are lower. So this is why, and so the risk of transmitting to somebody is also lower. I mean, you can still transmit, okay, but the chances are lower. So the boosters as the same formulation as the vaccine. Yeah, so So there is no difference between a booster and the Pfizer vaccine. I mean, it's just the Pfizer vaccine. The same one that has been given to 1 million over 1 million kids is used as a booster. I mean, there are no two different vaccines. It's the same vaccine.
Yeah, another question.
Is there a Omicron specific vaccine? Okay. Now they are looking at Omicron specific vaccine, and they have only done animal studies so far. So far, it is not looking that great. But what people are trying to do is not try to make Omicron or whatever variant specific vaccine, because by the time we make Omicron specific vaccine, another variant might be there. So it's a useless thing. So what people are trying to do is to make a pan-coronavirus vaccine, which would protect you against all types of coronaviruses. Okay, because these variant vaccines are not going to work. You will get another variant very soon, just as you make Omicron vaccine. So you need to make a pan-coronavirus vaccine. And so people have been, so many vaccine developers have been trying to do this for the past 1.5 years. Okay, so I know that we made a COVID vaccine very soon, but that is a very simple and uncomplicated vaccine. Okay, so whereas a pan-coronavirus vaccine is much more complicated. So this is why, although people have been trying for 1.5 years, they are still in the preclinical stages and not gone beyond that yet. So hopefully, at least by the end of next year or mid next year, because everybody is putting an effort in developing this pan-coronavirus vaccine, maybe at least by next year, if we have one, I don't think so, but I'm hopeful.
Yeah, another question that the mRNA vaccine is not considered as a vaccine, is it?
What do you mean mRNA vaccine is not considered as a vaccine? I don't know why. I mean, the definition of a vaccine is something that you give to alter your immune response. Okay, so the mRNA vaccines are very, very effective in doing that. And if I just give you the history of mRNA vaccines, now people have been developing vaccines for cancer to treat people with cancer. And we know that people with cancer have a very weak immune response, and they are very weak. So these normal vaccines don't work in them. The mRNA vaccines were developed for that, and mRNA vaccines were undergoing clinical trials in cancer patients since 2010. Okay, so mRNA is not a new thing. The mRNA vaccines, they were undergoing clinical trials in cancer patients since 2010. I mean, before 2010, because the first papers are published in 2010. Okay, so, and because they were safe, effective, and immunogenic in cancer patients, when COVID came, because they were fastest to make, when you need a fast vaccine, and people knew about the health safety profile because they were used in cancer patients, it could be rapidly turned around to make COVID vaccines.
Another two questions in chat box. Is there lifelong immunity after vaccination against COVID-19?
No, there is for coronaviruses, for any of the coronaviruses, there is no lifelong immunity. This is why we get common colds so many times throughout our life. And you do not get lifelong immunity to coronaviruses.
The question that why we do not focus on the innate immunity instead of enhancing the specific immunity by vaccines?
That's a very good question. So now if there was instead of taking the polio vaccine, okay, why don't we improve our innate immunity and let the polio virus infect us? I mean, who is happy to do that? Hands up. Okay, who wants to get polio and paralyzed? Innate immunity is non-specific. Okay, it is the specific immunity that prevents infection by a particular virus. Who wants to get polio and be paralyzed now here? Okay, so we don't have polio here. I mean, all of you were possibly not born, and me neither. Then they had these iron lungs, and people got paralyzed below neck even and died because of polio. Okay, we don't have polio anymore because of polio specific vaccines. We don't have smallpox. Okay, the smallpox lethality was around 20%. We don't have smallpox again not because of improving innate immunity, because we had vaccines that prevented specific infection. We don't have measles, okay, which killed so many again. I mean, because people don't know the amount of devastation these viruses, which are very effectively prevented by vaccination, caused, they have forgotten what vaccines have achieved.
You have any other question that the time is flying, actually, that with her busy schedule that she joined with us. Do you have any other questions to ask? One question that is that more effective?
Monoclonal antibodies. Yes, so monoclonal antibodies have been developed and were used for COVID, not through the intranasal route, but systemically to prevent systemic infection. And they were used even for Delta, but because Omicron is so different, none of the monoclonal antibody therapies are working right now. So FDA actually deregistered them because, I mean, no point using them for Omicron, the ones that were used previously.
Yeah, another question that asked from the student that what do you think about herbal medicine and traditional medicine in this scenario?
So there are very effective herbal medicines and traditional medicines which can, so as soon as you get infected, to give them, okay? And we have done clinical trials with the Ayurveda Institute at Navin, clinical trial, like, you know, properly conducted, randomized case control trials, which have shown very good results. And we are right now writing the paper, and we are also sort of, so I don't want to talk about it right now because we are still, but of course, definitely we have worked on it, and to show that all these, any drug works, there's a method of doing it, and it is very good to follow those methods. And of course, we know that the drug we tested, the Ayurvedic drug, was showing very promising, is showing very promising results.
Thank you very much. That I know that you are much, very much favor about that traditional medicine. You are joining hand with us. So now we are come to end that within this time framework. So I would like to thank Professor Neelika Malavige, Madam, that giving her thoughts within her busy schedules. So it's very much appreciated, Madam, that we got so many clearance actually regarding this situation. So then again, I would like to thank Senior Professor Piyani Parnagama, Madam, that Director of the Institute of Indigenous Medicine, for her dynamic involvement of this webinar series. Then again, I would like to thank our sectional, two sectional heads, Dr. Moldikoda, Madam, and Professor Shipa. Then again, I would not only not in the low age, that actually I would like to thanks, many thanks to the IT section of the Institute of Indigenous Medicine to join with us. So again, that there are so many requests that we now maybe we discuss in later stage. So if you miss this webinar, you can follow the YouTube version of this webinar. Actually, thank you very much, Madam, again, to joining with us.
My pleasure. Thank you.